Medial nerve is formed from the union of lateral root from the lateral cord and medial root from the medial cord. The lateral cord of the nerve receives fibers from C6 and C7, while the medial cord receives fibers from C8 and T1. Median nerve courses lateral to the axillary artery in the axilla. It exits axilla and enters the arm where it descends anterior to the brachial artery, and thereafter medial to the artery at the cubital fossa. It enters forearm by passing between the heads of pronator teres and continues distally in the fascial plane between flexor digitorum superficialis and profundus muscles. Subsequently, median nerve enters the hand underneath the flexor retinaculum. Median nerve gives an articular branch to the elbow joint in the arm. In the forearm, it gives off the following branches. 1. Anterior interosseous nerve. This arises distal to the cubital fossa and innervates muscles of the superficial and intermediate layers of forearm flexors, muscles, with the exception of flexor carpi ulnaris muscle. Anterior interosseous nerve also innervated the deep forearm flexor muscles, except the medial or ulnar half of the flexor digitorum profundus. 2. Palmar cutaneous branch. It arises in the distal third of the forearm, proximal to the flexor retinaculum, and gives sensation to the skin of the central part of the palm. 3. Unnamed muscular branches to the pronator teres, flexor carpi radialis, palmaris longus, and flexor digitorum superficialis muscles. 4. Articular branch to the wrist joint. The branches of the median nerve in the hand includes 1. Recurrent or thenar branch of median nerve. It arises distal to the carpal tunnel and innervates abductor pollicis brevis, opponens pollicis, and superficial head of flexor pollicis brevis muscles. 2. Lateral branch of median nerve. It arises from the lateral side of median nerve as it enters the hand. This branch supplies first lumbrical, skin on the palmar and distal dorsal aspects of the thumb and radial half of second digit. 3. Medial branch of median nerve. This branch arises from the medial side of the nerve in the hand and innervates second lumbrical, skin on the palmar and distal dorsal aspects of adjacent side of second to fourth digits. Median nerve may be injured during fracture of the distal end of the humerus, supracondylar fracture, or penetrating injury in the elbow region. Compression of the nerve may also occur in the forearm between the heads of pronator teres, otherwise called pronator syndrome, or in the carpal tunnel. This is called carpal tunnel syndrome. The nerve may also be lacerated at the wrist during suicide. Incomplete division of median nerve at the elbow region, the flexion of the proximal and distal interphalangeal joint of the first to third digits is lost. However, the flexion of the distal interphalangeal joint of fourth and fifth fingers is unaffected because the movement is produced by medial part of flexor digitorum profundus, which is innervated by ulnar nerve. In addition, the flexion at metacarpophalangeal joint of second and third digits is lost because of the affectation of first and second lumbrical muscles supplied by median nerve. Thus, when making a fist, the second and third fingers remain partially extended. This is referred to as hand of benediction. Pronator syndrome is the clinical manifestation of compression of the median nerve between the heads of pronator teres muscle, especially by activity that involves repeated pronation. This results in pain, paresthesia, and decreased sensation on the lateral 3½ digits and adjacent palm. Similarly, carpal tunnel syndrome arises from compression of the nerve at the carpal tunnel. This also results in pain, paresthesia, and loss of sensation in the lateral 3½ digits. In severe compression, there is loss of fine coordination of the thumb, such as when button a shirt. Due to weakness of abductor pollicis brevis and opponens pollicis, and pain radiating to the forearm and axilla. If this video is helpful, consider subscribing or clicking the like button.